Good day. And I say good day because it could be morning, afternoon, evening, depending on where you're tuning in from. I'm Mike McAvoy, the chairman of the EMS section for the International Association of Fire Chiefs, and we welcome you to our Medicare Ground Ambulance Data Collection Survey, How to Avoid Medicare Payment Reduction. And I don't think this could be any more timely. We have been hearing about the Ground Ambulance Data Collection Survey for a couple years now. Had this little thing called COVID that got in our way, but it's coming to fruition starting in another month. And so we're happy to have some partners join us from PCG to do what I think is an outstanding presentation to catch us up to date on the requirements and what's involved with the cost reporting. A couple of housekeeping items before we begin. We're broadcasting this through a similar platform to Zoom, a voice over IP technology. Make sure you have your volume tuned up on your headset or on your speakers. We have muted the audience microphones. And if you have any technical difficulties, there's an email here that you can email to webinars@IAFC, or probably easier to hop on to the chat or the Q&A and just put a notice in there that you're having some issues, and we'll try to troubleshoot that for you. As far as handouts and questions and answers, etc., we encourage you to make notes in the chat box to post questions in the Q&A. We'll pause a couple times to take questions about the sections of the presentation that we have. We have two presenters who are going to be talking today, and so we'll stop in between those, and then we'll have some Q&A at the end of the session. And then the folks from PCG have been kind enough to post on the handouts tab, which you'll see in the upper right hand corner, 4 handouts, one of which includes the slides from the presentation today and some others about the services that PCG offers to help people with cost reporting, with finances and healthcare issues, and everything that they do for the fire service and EMS services here in the United States. So those are posted under the handout session. We do intend to archive this presentation today, and we'll post it with our other webinars that we have on the iafc.org website. But clearly, this is a good opportunity for you, if you're live with us today, to ask questions and take advantage of the expertise that we have with us. So we thank our sponsor, the Public Consulting Group, PCG. They are a 5 Bugle partner of the International Association of Fire Chiefs. They put on a number of really good webinars for the EMS section pertaining to billing, cost recovery, how to start up an ambulance service, and all the things that pertain to reimbursement for the EMS services that the fire service provides. We have 2 presenters with us today. Alina Kaufman, who is a senior manager for the Public Consulting Group, and Sarah DeSico, who we've heard from a couple times in the past, and she also is a senior consultant with PCG. So I'm going to turn the podium over to the 2 of them and let them take it away.
Great. Thanks so much, Chief, for the introduction and for getting us through logistics. We're always happy to partner with you, and our goal today is to really provide some practical information to help you all, avoid the payment reduction. So I'll do a quick introduction. I'll let Sarah introduce herself. We have been working together for a year and a half on the Medicare Ground Ambulance, so we'll be tag teaming today. And then we'll get into the agenda, and I'll cover part 1, and Sarah will cover part 2. And as we mentioned, we'll have a couple of opportunities for questions. A little bit about myself. I have been with PCG for 10 and a half years. I'm currently working under the Healthcare Financing Solutions team. I've been doing the Medicare Ground Ambulance, as I mentioned, for a year and a half. I also manage all the projects that we do for public safety consulting. So we work with fire and EMS agencies on any operations consulting kind of work, feasibility studies, strategic planning, whatever it is you might need. That's what we'll assist with, and also have a little bit of my toes into the cost reporting for the ambulance supplemental payment program. So excited to be here and hopefully share some useful knowledge. Sarah?
Thanks, Helena. Yep, happy to be here. Excited to share this information with everybody. We understand that some of you might be more familiar with the cost survey than others. So we are trying to give kind of a basic level of information and then touch a little bit deeper in some areas. So please don't feel overwhelmed. As the chief mentioned, this PowerPoint presentation is available to everybody, so you can reference it later. You can grab those high level or more detailed pieces of information at your convenience. And just know that PCG is a proud partner of IFC. We're here for each and every one of you to serve your community as best as possible. I believe Alina and I are going to go off camera as we start into the meat of our presentation, and then we'll join you on camera again as we hit the Q&A session. So I will let Alina take it away from here.
All right. Thanks, Sarah. Okay, so for today, this is our agenda. We're going to give you a little bit of background on PCG. Many of you may already know us, but we'll talk about our expertise. And then we're going to get into, the purpose and the overview of the Medicare grant ambulance data collection. We'll pause to ask for you to ask any questions. And then Sarah is going to go into the actual data elements to be collected and the timeline and any initial steps to get you started. And then we'll have other opportunities at the end for some additional Q&A. A little bit about Public Consulting Group. We are a obviously public consulting firm. We have been around for over 35 years, and our focus is really working in the public sector at the federal, state, as well as local levels. We have several practice areas that focus on education, health, human services, and technology as well. We have a very strong presence all across the US with offices across the country, as well as Canada and the European Union. And one of the our focuses has really been on working with Medicaid agencies, and our experience is really broad. So we're able to assist with setting up federal programs. We're able to assist at the state level, and then we also, from our experience working with 500 fire and EMS providers, we're able to bring that experience and have a pretty holistic view of what's happening with Medicaid and Medicare. We work in all 50 states. We currently have contracts with more than 30 Medicaid agencies. And so again, we're able to really bring that experience to you. Especially, we were the first to develop the ambulance supplemental payment program back in 2009 with an agency here in Texas, where I am at. And so we bring a lot of knowledge. And so as we're talking about changes to policies or changes to programs, we're able to understand that holistically and also from the provider level. Oops, just a little too quick on that slide. In terms of some of the services that might relate to you, we've got a couple of different areas, as we mentioned, revenue optimization, cost settlement, supplemental payment services. All of those are areas that we are very strong with from the financial perspective, assisting with program design, program evaluation, seeking state or federal approval, implementation of programs, training, EMS, cost reporting, both supporting providers, as well as a couple of states were actually implementing the program on behalf of the state, giving audit support, as well as technologies that we use for cost reporting and any customization. So that's something that we can bring to a program like this, where we're collecting data. They're going to be looking at all of the requirements. So that's again knowledge that we can share with all of you. The next one is exactly this: the Medicare grant ambulance data collection. So we've been working on this for about a year and a half. We're able to provide assistance in preparing, supporting, training, and actually completing the survey, as well as giving any audit support. As I mentioned earlier, I do manage the public safety consulting service projects, and so we do a wide array of projects and consulting work for fire and EMS departments, operational studies, efficiency studies, EMS systems. We've got departments that might be merging or that might be splitting away from a department. maybe starting up a new fire station, health equity studies, and a lot of, getting into the work of crisis intervention programs, mobile integrated health. So obviously that's an exciting place for me to talk about. And then we're also, providing support for ET3 and mobile integrated health. So we've assisted with states with departments applying for the pilots, program approval for other payers, implementation and support, and analysis of mobile health options for the community. So obviously we like to be able to provide a really well-rounded approach to anything that our fire and EMS providers might need.
And Alina, just a plug right there is we are going to be hosting a webinar with IAFC on alternative destination models in the month of January. So everyone, please stay tuned for those details.
Thank you so much, Sarah. That was a great thing to point out. All right, let's talk a little bit about Medicare Ground Ambulance, which is what you all are here to do today. And as Sarah mentioned, some of you may know a little bit more information than others, but I want to start kind of at the very beginning. Back in 2018, the Centers for Medicare and Medicaid implemented a new ground ambulance data collection system, essentially a survey, to comply with requirements that were passed in the Bipartisan Budget Act of 2018. So why are they doing this effort? Essentially, you all know that the current Medicare rates don't adequately reimburse providers and suppliers across the U.S. for providing services. We also know that ambulance operations vary widely in terms of size, geography, the way that they're operating. And so they're wanting to be able to collect data to really understand the full spectrum of ambulance service providers. And hopefully they're going to be able to get a better sense of the industry, and eventually with a goal of being able to update payment rates for the Medicare ground ambulance. So I believe that the rates have not been updated since the late 90s. So obviously, the current environment has really changed since then, and it's really about time for them to get a better understanding and be able to update rates. Sarah, any additions to this?
No, fantastic. I think that covered all the main points. I will point out that this was a mandatory progression that came down from Congress. So not only did CMS see a need for this, but Congress itself wanted to make sure that this program was put into place so that they could also evaluate this information and potentially provide any additional analysis or support to CMS to, again, support or pass along any reform that might come from this.
Awesome, thank you. A little bit about the highlights, as we mentioned before, this program was supposed to start several years ago, and due to COVID, obviously the data that would be collected would really not be representative of, your actual operations, considering, how COVID has changed things. And so while, they basically were going to select a sample group between 2020 and 2024, the original idea was to be able to select a group of providers every year, about 2,600 per year for those 4 years, who would be selected to participate and report. Now, because of COVID, they basically merged kind of 2 cohorts together. And so we're looking at those selected for year 1 and year 2, who are going to start, collecting data in January, in 2022. We'll talk about the timelines here in a second. And then for years 3 and 4, those have not yet been selected, but they will be selected. So essentially they're going to be, grouping years 1 and years 2 together. In terms of the actual collection period, you're looking at a 12-month continuous data collection period. You have the opportunity to either choose between the calendar or the fiscal year. And if you don't choose, then they will decide for you and you will be defaulted to that calendar year. Essentially, the clock will start ticking at whichever point you decide, calendar or fiscal. You'll go through those 12 months. And then once that collection period is over, you'll have 5 months to officially gather all the information, package it up in the way that they want it packaged, and then report the information no later than, the 5 months. In terms of how you're actually going to do that, they are developing a web-based system. And I'll show you the form here in just a second in terms of the actual requirements. Sarah's going to go into a lot more detail on the data itself. But as far as logistics, they're going to be, there's a data collection instrument that outlines all the requirements, and then providers will essentially be going into a web-based portal to enter all the information. So we have not yet seen what this looks like. They were going to have this portal ready by now, but obviously because of COVID, everything's been pushed back. So most likely they will have the portal available for the first cohort, by December of next year. So we'll have yet to see exactly what that's going to look like. And then as far as resources, CMS released an updated document and FAQs back in 2020 originally. They should be releasing some additional information in hopefully by the end of this year. If you have not, kind of looked into the resources available, I know we have a couple that are handouts as well, but I will take a minute here to pause and maybe show you the CMS website. So let me just share my screen here.
And while you're doing that transition, Alina, again, to our audience, just want to make sure everybody understands that if you performed one ground ambulance transport for Medicare in 2017, you will be fulfilling the requirements of this program. So whether or not you've been selected and you're going to start in 2022, or you haven't been selected, that means you will start collecting in 2023. And just as a reminder, when we do talk about grand ambulance transports, we are talking about vehicle transports as well as water transports, but this program completely excludes air transports.
Great. Thanks for that clarification. Are you able to see my screen?
Yes, ma'am.
Awesome. All right. And actually, some of the information that Sarah just pointed out as far as the requirements for, who is required to complete the survey, I've got a slide coming up in just a second we can revisit. This is the CMS website. I believe there's a link as part of our PowerPoint presentation, but just wanted to highlight that there's additional information here, including the latest FAQs that were released this past July. So we will certainly be on the lookout for any new information that's coming out here in December. I would imagine that they will be putting something out here. And they are also doing a webinar, I think it's on December 14th, to provide additional information. So from our perspective, we're always on the lookout for what's happening, and we're always happy to disseminate that information back to you. Okay, let's get back to our PowerPoint here. And let's talk a little bit. We're actually going to do a quick poll as we talked about the purpose of, why they're doing the Medicare Grand Ambulance data collection. We want to know from you. We like participation. So we want to know what you want to see CMS develop from this Medicare data collection. What do you think you want CMS to get out of this? And we'll take a look at results here in a minute. All right, I see that the poll is closed. See if I can share some feedback with you all. So the majority said all of the above. So 51% of you said that they like to see all of those. So reform or rate increase, have a better understanding of the labor force and hopefully the diversity of the organizations, and really providing support to additional rural departments. And then another pretty big chunk, which was 42%, was really focusing on that reform or rate increase. So part of that is, for all of us to really say, this is why it's really important for all providers to really engage and be able to provide this information so that your particular agency is represented in the data and they're able to have the information they need to make those decisions. So thank you so much for participation. Bringing it back to the question of who's required to complete the survey. Again, as Sarah mentioned, ground ambulance providers that were enrolled in Medicare with at least one transport billed in the last year. And I think, for year one that would have started in 2017, then you're essentially within that pool of providers that's going to get selected. And again, they were looking at trying to really stratify and do a random sampling of the different kinds of providers. So they were looking for, for-profit, volunteer, government, and hospitals. So pretty diverse range. They were looking for, rural and urban providers, and also looking at the volume of the transport. So that's a little bit about how they were originally doing the selection. Either way, if you met that first criteria, you will be selected sometime between that 2020 and 2024 year. So if you're not a year one or year two selectee, you will for sure be year 3 or year 4. They will be communicating out. And in fact, I can show the letter here on this next slide. If you were selected, you would have seen a letter like this. I know it's a little bit hard to read, and this is back from 2020. But CMS will be sending out updated letters this month. We were hoping that they were going to send them out last month, but we've so far have not really heard from any provider that actually has received a letter. So just look, if you were year 1 or 2, look forward to seeing this information hopefully this month. But you will see a letter that's very similar to this. And we hope that they will be identifying the year 3 providers sometime this month or into January. So again, we will certainly keep you posted if we hear anything. I know we see some questions in the chat, so I do want to acknowledge those, and we're going to pause here in just a minute to answer some of those questions. I did want to talk a little bit about the data collection periods. As we mentioned, it's going to be 1 full year that you will be collecting information for, but you have the chance to decide on calendar or fiscal year. You will be notifying that back to your MAC. And I think you have about 30 days from the time that you are notified that you've been selected to be able to give them that information. So what does it look like? If you've actually been selected, what does the process look like in terms of collecting and reporting? This is a couple of examples for you. So if you are on a calendar year, and let's say you're year 1 or year 2 selectee, then yeah, there's a lot of pressure right now. For a while, we've been like, we don't have to worry about it. But definitely if you're a calendar year 1 or year 2, then you're going to begin your data collection in January. So January 1st. Then you're going to go all the way through December 2022. And then beginning in January 2023, you have 5 months to, again, collect all your data and kind of have your package ready and submitted. Now, what does it mean to start collecting your data? Essentially, your clock will start ticking in January. There's really nothing that you're doing specifically. You will obviously need to run reports when you get to January 2023. But part of this conversation, and Sarah will go into it, is definitely want you all to be prepared to understand what the requirements are, to make sure your systems are ready, to make sure that you know who you're going to be collecting information from, and that information is available. So, there's nothing specific that you're doing to actually collect the data until January 2023, but we want you to start being prepared now so that by the time you get there, you're ready to roll. It looks a little bit different if you maybe select a fiscal year, so you can see on the bottom, we know several providers might be on fiscal year ending in September. And so if your data collection period would start October 1st, 2022, would run through that November 30th, 2023, and then you start collecting, your data ready for reporting on October 1st, 2023. So essentially, you're not actually going to be, you could be submitting as late as February 2024. So it's a little bit about what that looks like. So really just figuring out, when you're starting your data collection, figuring out 1 year from that, And then 5 months from the end of your data collection is when you've got to have your data submitted.
And Alina, we always get the question, which reporting and collection period should we go with? Should we go with the calendar or should we go with a fiscal year? And that is truly a decision that is best for your department, meaning there's no advantage one way or the other in CMS's eyes to do it on the calendar or the fiscal. What we recommend to our clients is do what is best for your staff. So if you do have busier times of the year, kind of decide on which collection period might fit that better, as well as if you are running your budget. So if your budget is on the calendar year, it might be best to do it with that budget season, because you will actually be able to represent your full expenditures a full year of your staffing using that budget year. If you do participate in a supplemental payment program, or what some states call a GEMT, an ASPP program, you also are required to do an annual report for that program. So it might be easiest to do this collection period at the same time. It might also be nice to offset it so that you're not having to deal with both reports during the same time period of 5 months. So those are just some pros and cons I wanted to highlight for our audience today on these collection periods, but we're always happy to kind of strategize with each individual department to make sure they are selecting the best period for their department.
While we're on this slide, there's a question in the chat that says, where do I go to pick the fiscal year versus the calendar year?
So I believe, oh, Sarah, do you want to answer that?
Nope, Alina, go ahead.
I was just going to say that I don't think you're picking it anywhere necessarily. You're going to get that letter from CMS and you would report back to them. I'm bringing up, coming back up to that letter here that we were showing. So I'm reading here. So they're talking about to begin you're required participation, provide the 12-month period. If you don't provide it back to your MAC, they will receive for you. So it basically gives you information in that letter as to who you need to who you need to mail the letter to. Sarah, anything to add there?
And this is kind of an interesting subject, because we all talked about this Monday when we were practicing. And what would your thought be for an agency that doesn't get a letter, but they know they were selected?
I mean, I would say that, more communication is better than less. So first, I can also share on the website that I just shared earlier, they have a list of all the providers for year 1 and year 2. So if you have a question as to whether your organization has been selected, you certainly can, go into that website and double check. You can always email us. We've got those lists all the time. But yeah, if you've been selected and maybe you haven't gotten the letter, I would certainly recommend, reaching out, and at minimum, they're going to need to know which collection period. But again, from what we've heard, they will be resending those letters again for providers that have been selected. Sarah, anything to add from your perspective?
Yeah, and we'll go into this a little bit later when we talk about initial steps and strategies, but what we would recommend if you have not received any communication regarding this program is to get into PECOS, the Provider Enrollment Chain and Ownership System, and we do have a link to that as well. And in that, you want to make sure all of your contact information is up to date. We do know that there are staffing changes all the time, but those contacts, both your hard mail address as well as your email address, is how CMS is going to be communicating with each department to not only let them know that they've been selected to participate, but that's also how you'll receive your notification letter that everything has been successfully submitted and you're officially, quote unquote, off the hook. So definitely check out PECOS. And again, we have a link to that website so you can ensure all of your contact information is up to date.
Thanks, Sarah. And I'm showing here on my screen the year 1, year 2 providers right there.
And that's probably pretty easy just to Google if somebody was looking for that list. But yeah, I think that link is in the materials that you provided us.
Yes.
It
All right.
is, and Nan just graciously added that link into the handout section of this webinar. So if you are anxious to check out whether or not your department has been selected, feel free to use that link at the end of this webinar.
Great. Thank you so much. Really, really good questions. These are similar questions that we get often. So hopefully we're able to help you out. And like I said, should be able to get that notification out again soon. I do want to share with you a little bit about the instrument. That's going to get us into the conversation with Sarah so she can get a little bit deeper into some of these categories. So on the PowerPoint here, you'll see what they refer to as the Medicare Ground Ambulance Data Collection Instrument. This is essentially the document that outlines all of the requirements in detail. It is organized into 13 different sections that Sarah will be able to show you in a little bit. And essentially what we're thinking is that the system itself is going to kind of use skip logic once you're actually in there to report your information. They're going to collect details about your particular characteristics. So they may ask, do you share costs? Or do you have volunteer staff? So depending on your particular background, they're going to collect that information up front, and then they'll present the questions that are relevant to your organization. So you'll see that's how this document is developed. It's a little bit difficult to read sometimes because it'll say something like, if you answered yes to question number 2 in section 7, then fill this out. And so you're having to kind of go back and double check, well, what was section 7? So that's how it is set up. I was going to kind of share the whole thing with you, but for keeping this a little shorter and allowing Sarah to get into hers, I won't share it, but there is the link here where you can see the document. I think it's about 70 pages or so. And again, it's in that same website that I showed you. So not the most user-friendly in terms of being able to understand what the requirements are, but we're going to break it down for you here in a second. All right, and then, before we really get into the details, this is really the most important thing that we wanted to share with you today. What happens, how can you avoid that payment reduction? Essentially, if you fail to report, or if you fail to report accurate information, then you may be subject to a 10% reduction in your Medicare payments under Medicare Part B. This would be starting, January 2024 for folks that would be reporting in 2023. So again, there's no way for you to get out of reporting necessarily. There is a way for your organization to seek an information review and determine whether you might be exempt from the actual payment reduction. So, we just really want to encourage everyone to, submit the information, do your best to collect. They really want all providers to, be represented in the data. All right, Sarah, anything to add on that one?
No, I will say that everyone, or not everyone, but we have had some concerns about the audit process. And, what if we put all this effort into doing the report and then they still come back and deem it insufficient or inaccurate? So what I would say to our audience today is that don't necessarily worry about that audit process. From what we understand, it will be more informal. Again, if you're a part of the Medicaid, GEMT, or ASPP programs, you might know what an audit looks like, and it is treacherous and it takes up so much time from your department. This is not going to be the case with the Medicare side of things. So definitely take your time in collecting and reporting the data. Do the best job that you can. You will even see in the instrument, sometimes it will say, give your best estimate. So try and give accurate reporting as best as possible, but it is more important that you do complete the instrument to the best of your ability and submit it so that CMS does have this data so that they can make informed decisions on what that reform is going to look like. And they can't do that if departments are not participating. So again, just encouraging everyone to do the best that they can on this. As Alina mentioned, there is no exemption to completing the instrument. The only hardship exemption would be given out to those that completed it or then docked the 10%, but they can show why they might need that additional 10% through the course of 1 year for their Medicare Part B payments. And at that point, CMS can deem that exemption. So just wanted to point that out.
Great. Thank you so much, Sarah. So on my last slide that I'm going to show, and then we'll pause here in case there's any additional questions, and then let Sarah continue into the details. This just goes over some revisions that were proposed in 2020 for 2022. Nothing for you all to really kind of worry about. They're just a little bit of clarification on organization characteristics, clarifying the service areas that they were originally going to ask for primary and secondary service areas, and information about labor costs. So again, some of this is just clarification to that data collection tool that we showed. I would expect maybe some additional information coming out here in December as they do that webinar on the 14th as well. All right, let me pause here. I know we've answered a few questions, but I want to make sure that we're answering all the questions that are open here.
There's a couple more. Let me ask a easier one, and then I'll ask a complicated one. There's a question about not being included in the original selection, but not appearing on the 2 updated lists. And from the best that you ladies know, would there be any more additions to the 2 lists that were posted, or can you presume that you will be in the final list?
I mean, from my understanding, the 2 lists that are posted currently to that CMS website, and if you go, you can download, it's a zip file, and I see like just downloaded it again. So there's about 2,600 providers on the first one. So they went ahead and did 2 separate selections. They will do a 3rd selection coming up here soon. And then obviously, if you're not in that 3rd selection, you are pretty much guaranteed to be in that 4th. So, but I don't know if it was a question more that they were notified that they were selected, but then they don't appear on the list.
Well, it says we were included in the original selection, but don't appear to be on the updated lists.
Yeah, I would double check the NPI number, making sure there's nothing changed there. And I'm not aware that they've changed the list. I know that they, put out the selection back, a year and a half ago or whatnot for year 1, and then they put out the selection for year 2. I don't believe these are updates. I believe that, the first cohort was selected, the second cohort was selected. So it's a little surprising that, that their data may be inaccurate.
Yeah.
Sarah, any thoughts?
Yeah, I definitely second your suggestion about checking by NPI number, because again, if your information is incorrect in PCOS, whether that is maybe your mailing address is a different state, because you have multiple locations or anything like that, could definitely skew why you're not seeing your name. Again, maybe you've changed your name or the wrong name is entered for you, but definitely selecting by or searching by NPI number would be my suggestion. And then CMS does have an email address on that website that Alina has been gracious enough to show everybody. So if you need to contact CMS and work out any of those questions, they do have a direct link to somebody who is just really catering to these specific cost survey questions. And we would recommend you reach out to them in that way if you have any additional questions or concerns about whether or not you have or have not been selected. And of course, PCG is here to help with that as well.
I'm gonna go ahead and put that that information out. I'm gonna put that email right there.
And then here's another question. We were on the list for year 2. Does that mean the data collection is in 2022 or 2023?
Great question. So I can kind of go back to that slide. So if you were selected for year 2, both year 1 and 2 will be reporting. So essentially, you will begin your data collection in 2022, no matter what. Now, if you select calendar year, you will start your data collection, your time starts ticking January 1st. And in that case, you will not be reporting until 2023. So the earliest that you would be reporting is this period here that I'm showing, May 2023. That is the very first cohort. Now, if you maybe choose a fiscal year reporting, you still would start your collection in 2022. But, depending on how that falls, you could either report, in 2024 or even 2023. So here's some examples there. Again, the clock will start ticking in 2022. The main question will be exactly, when do your 5 months for when you're actually having to package and submit?
So it really doesn't matter whether you're year 1 or year 2.
Nope.
Your clock starts January 1 of 2020.
Well, you just have to decide whether you're going to go calendar year or fiscal year reporting, right. But either way, your clock will start ticking in 2022.
Okay.
And
now I mentioned
I want to point out that these are samples. So these is not all inclusive of all the fiscal periods or fiscal years out there. We just know from our standpoint, these are some of the more popular, October 1st, July 1st. So there might be somebody who has an April 1st fiscal year, and you are welcome to select that April 1st fiscal year. So again, this is not all encompassing, but just a few samples of popular fiscal start and end dates.
Right. So basically just pick your start 12 months from that, that it represents your sort of collection period. And then 5 months from the end of your collection period, you've got those 5 months to actually package and report.
Okay. So I mentioned we had a little complicated question, and I think there's really 2 parts to this. It starts out saying we use a third-party billing company. Do we submit the information, or does the billing company? And obviously, the billing company would only have part of what's asked to be reported, right?
Yeah. So was that the full question?
No, there's another piece to it.
Okay. Let me answer this to the best of my knowledge. We obviously work with providers who have third-party billing. We do that for the, ambulance supplemental payment program. So we're pretty familiar. What I can say, I would imagine that, if you're a provider and you are participating and you're going to be collecting your data, that is something that you would collect from your billing vendor. And you would, include that as part of the reporting, because there's a couple different places where they're going to be asking for costs and things like that. And as far as we know, right now, you're going to be submitting through a portal, right? So they're going to need to be able to provide a secure login to that web portal. We do not yet know if CMS is going to give access to a third party. So for example, if PCG was assisting you with, your data collection, and we were going to kind of take it all up on ourselves to do it up on your behalf, we would collect all your data, we would package it up and say, okay, this is kind of what this is what your final reporting elements are. We don't know yet whether they would give somebody, for example, like PCG or your billing vendor access to actually go into the portal. So we don't know that yet. Sarah, I don't know if we've asked that, I feel like.
We have not yet gotten a straight answer from CMS if that proxy will be available, as again, those that might participate in Medicaid supplemental payments, we have that ability to do that particular function with the individual states once a client has signed a participation form that gives us the authority to submit on their behalf. We have not yet heard if CMS is going to allow this for this particular program. We have our fingers crossed, because we know that will eliminate one more step that our providers don't have to check off their own list, but we are still waiting for clarification on that. And just to reemphasize what you said, billing is only one part of this survey. So while your billing entity might be able to provide you the documentation to answer certain questions in the survey, it will not encompass everything that they're asking for. So you will have to just get that data and make sure that your billing company is collecting the right information. Again, we encourage you to go into the instrument and take a look at that, or talk to an expert at PCG. Will help you kind of identify what you need to make sure your billing company is capturing, because it might be a little bit different than what you're currently reporting on. And so once you got them set up from, again, day one, they're collecting that information for you. And then at the end of that 12-month period, you would just ask for a final report. We usually like reports in an Excel file because it's much easier to aggregate or disaggregate the information, or get rid of columns you might not need for this particular instrument. And then once you have that, you would be able to, again, compile the billing section with the information given, and complete that section. But you're really going to have to coordinate with several, probably different vendors or internal departments to complete the entirety of the survey.
Okay. And then the second piece of this is a little complicated, and it's basically saying that the county does the billing for all the volunteer and career departments, and all the money comes in together. And so the question is, would this be reporting for all of those simultaneously? And I think the answer depends on whether they have separate NPIs or not.
Yeah, there are quite a few caveats in that question. So certainly, this instrument is specific for one individual NPI. So if you do have multiple NPIs or a parent NPI, they are going to ask questions throughout the instrument that ask, what percentage of that cost was deemed from your parent NPI. So on and so forth. So what we would suggest is to, again, coordinate with the powers that be, the different vendors, the different billing partners that you might need to work with, to make sure that everyone's capturing the data that they're responsible for, and they know when and how to get you that information when the time comes.
Good. And I think we're pushing at time now. So do you want to continue with letting Sarah talk?
Yeah, Sarah, it's on me. Yeah, you got this. It's all you. Good
Right.
question, though.
Yeah, great questions. And this is what we really wanted. We wanted it to be more of an open forum, since we do know, again, some departments are starting as soon as January 1st. So this might be your last opportunity to get these questions in, whether that's to PCG or to CMS. As Alina mentioned, they are having a webinar on December 14th. So I'll take the next 10 minutes to just go over a few of the data elements that make up the instrument, because I'm sure now that you know some of the basic reporting requirements, the question on the top of your mind is most likely, what exactly are we going to have to report on? We've mentioned billing, and we've casually mentioned your organizational characteristics. But on this slide, you can see a brief overview of the 13 sections that compose the instrument, and what your department will need to be collecting from day one for this collection period. And as you can see here, providers of the ground ambulance services will need to collect and report on expenditures, depreciation, revenues, utilization, and a few other pieces of information. For those that, again, do participate in a Medicaid cost report, you might see this and think there are some similarities, and there are a few, but what the Medicare cost survey is asking for gets much more granular. The data is going to need to be reported in an aggregate, but also for this particular program, which is different from a GEMT or ASPP program, is that it is also going to ask for information or data by category. So for instance, by an individual facility, by an individual vehicle, or by an individual labor resource. So that's quite different. One of the other things that we want to point out is that CMS recognizes that some agencies share operational costs with fire departments, other public service organization, air ambulance services, hospitals, or other entities. Therefore, a key factor in completing this instrument correctly is making the distinction between cost and revenue related data that is entirely related to ground ambulance, partially related to ground ambulance, or totally unrelated to ground ambulance. So sometimes that could be the most difficult part of filling out these type of forms or surveys is, well, we don't know our allocation rate. We don't know what percentage to put towards ground ambulance versus other public service activities. That's one thing that PCG prides themselves on, our intellectual property, the algorithms that we've come up with to help departments sort through that information. We're again here and available to work with your department to make sure that you can separate those costs, and other characteristics that the survey is going to ask for. So I'm not going to go into each one of these each one of these categories or data elements, but I am going to ask the audience very quickly whether or not, or what section of the instrument you feel presents the most challenge for your department. Do you think that it will be reporting on labor cost, facility cost, vehicle cost, the revenue and billing section, or you know what, all of the above is going to be difficult in itself? All right, and it looks like we do have the poll going, and we'll give it just another second. I see some entries getting put in there. All right. So just to give a summary, so you might feel like you have some camaraderie with those on the line today. It does look like the majority of those who answered this poll question are nervous about all of the above, with one of the main categories being at 21% of the poll being facility cost. So that's interesting. Honestly, I really thought we would hear that labor cost was at the top of everybody's mind, but hearing that facilities cost is also in a second important category, that definitely gives food for thought for PCG to make sure that we can address any of those additional concerns or questions that you might have on facilities costs. So after this presentation, if you have specific questions, feel free to email them into us at any time and we can help you sort through that particular section of the instrument. So right now, now that we kind of have a high level overview of what needs to be collected, the question is, where are we going to get this information from? So what you see on the screen is kind of the most distinguishable documents as to where you might find the data. So for instance, your expenditure report or general ledger will give your cost. Your CAD data is going to be very, very important here, as well as your billing records, which you've already spoke about. So there are some distinctions in regards to the particular data points that need to be collected when we talk about each one of these reports. We do have a kind of needs assessment or data checklist. So if you're not sure whether or not your system is currently collecting the correct information, we're happy to provide you that documentation, and you can do a little self-assessment and determine whether or not you needed to make any adjustments to be able to properly collect this information and report it back to CMS. Today, we chose to dive into staffing and labor cost because, again, there is multiple layers of complication when it comes to Section 7, because you are going to need to first identify each staff category. So the instrument actually provides you 3 levels or 3 categories for staff. That is EMT and response staff. There is a medical director, and then there's administration/facility staff. So when you list out every single staff member on your team, you're going to have to assign them to a category. Now, within those 3 categories, there are then subcategories under the response staff, as well as the administration and facility staff that you can see on the screen before you. I apologize, I didn't skip ahead on my deck. So now you can see the different subcategories of the staffing section. Once you have identified which classification each staff member falls under, you will need to indicate whether the staff member was paid or volunteer. If a staff member started as a volunteer and became a paid employee, CMS has requested that you mark that employee as paid for the purpose of this survey. If a staff member changed roles, for instance, went from a EMT basic to an EMT intermediate, you would need to classify the employee based on his or her standing at the beginning of the collection period. So as we mentioned, whether you're starting in January 1st or October 1st, whatever position that person obtained at the beginning of the collection period, that is how they should be reported in this particular instrument. And each member should contribute to only one labor category for this purpose, even if they perform multiple roles within your organization. So if you have somebody who might be in your call center, but then they also work as a volunteer out in the field, you need to classify them accordingly, and they can only play one role. Once you have them classified, we went through here kind of what to do if you have shared services. So this is just a brief overline. If you have shared services, yes, I do. You can see how to include particular staff and who not to include. And of course, on the right-hand side, if you don't share services, you're going to include all employees in your reporting. So to just briefly move on to the next slide, this is a direct insert from CMS's training where it really runs through kind of how the workflow should be organized to categorize each individual employee. I'm not going to spend time on it because we only have a few more minutes, but just know that this resource is here and available for you. Once you have identified each classification, then the survey is going to ask you to identify which one of those employees had roles in and was paid for fire, police, and public safety, which ones had volunteer roles without fire, police, and public safety roles, and then, of course, the flip side of that. So it just requires really reading through the instrument very slowly and very particularly to make sure that you're answering the right questions and placing the right check marks by each one of your employees. And I will just give a general overview. So in addition to kind of classifying your employees, you're also going to have to report on annual compensation, total hours, and then hours unrelated to ground ambulance or fire, police, and public safety duties. And so we have a great slide here. This is again a screenshot from CMS's instrument you can take a look at. But this slide here really breaks down how to answer these questions and what to consider. So we would encourage you to come back and visit this slide at a later time to get a little bit more information on how to report. And then moving forward, we've got some first steps here. So we mentioned making sure your information is up to date in PICOs, signing up for any news information, whether that's from CMS or from PCG's newsletter. You want to be kept up to date as changes have occurred and I'm sure will continue to occur. Understanding the data elements, you have seen that there is 48 pages of documentation to sort through. There are 13 different sections to understand and to make sure you are prepared for. So do that now. Do not wait until month 12 of your collection period because you will find yourself having to go back and try and create, alter, or estimate numbers when we would like to avoid that as much as possible. And again, we've talked about making sure your systems are set to collect the proper data, and that might mean organizing different departments or external partners with that particular information. We've provided all of our resources here. These are clickable links if you download the handout that's available to you today. And just a kind of a plug, if your department just does not have the resources, if you don't have the experience to be able to handle a survey like this in-house, we are here to help support and guide you through this process. We have a couple of different layers of support services that can choose from to help fit your budget and your needs. So please reach out to us if you need any additional support or just to have questions in general. And here is how you can contact us. We've got Alina and my email address up here. And then if you wanted to check out our website or our blog, you're welcome to do so there.
Well, great. Thanks to both of you, Alina and Sarah. And thanks for everyone who tuned in to listen. There are a couple more questions which I think you have already answered. One of them is how to figure out the PICOS link, which is on the slides. And there have been a number of folks who are interested in getting a copy of the slides. If you click on the handouts button in the upper right-hand corner of your screen right now, you have the capability of downloading the slide deck as well as the other materials that PCG has left for us. And I think that pretty much covers most of what I'm seeing in both the chat and the QA. So any closing words from either Sarah or Alina?
Thank you again for having us, IFC. Always a pleasure to partner with you and to provide this type of information to your membership. And just remember, we're always here to answer any questions you may have. It doesn't mean you have to sign up with us, doesn't mean you have to be a current client. We are just an available resource to you. So please reach out if we can be of assistance.
Great. Well, thank you both for joining us and giving us so much good information this afternoon. We are going to send a link to everyone who participated along with a brief survey. So please let us know how your experience was today. And thank you for attending. We had pretty close to 100 people join us live, and we're going to archive this webcast. So even if you missed getting the handouts here, give us a couple days. We'll have this posted online at iafc.org. We did mention that in January, PCG will be doing an alternative destination webinar for us, looking at some different models of alternative destinations. So for those involved in ET3 and probably others who could use alternative destinations at this point, that will be an interesting move to go forward with in the new year. So thank you to everyone who joined us. Thank you to our presenters. And thank you to PCG for your continued offering of education for the members of IAFC. We appreciate it.
Thank you.
Thank
Happy
you.
holidays to everybody as well.